You've looked in the mirror and wished your eyes looked a little younger or more awake. You might be able to get that look for free. Your insurance could actually pay for it. Dr. Justin Johnson is an oculoplastic surgeon at Utah Eye and Facial Plastic Surgery who specializes in eyelid procedures, done them thousands of times. And you say there are some times when insurance will actually cover the cost of this?
Correct. Insurance does cover it, quite a bit at the time.
And what are the requirements for that to happen?
Well, there's two criteria that Medicare uses. Medicare sets the criteria, and either you have to have a certain amount of visual field loss or you have to have tissue that's actually pushing on your eyelashes.
You've done thousands of these procedures, as you mentioned. You even brought in some pictures, some of the before and after, so we can see exactly what can happen. It's either with the eyelid procedure or a brow lift. Explain what's happening in some of these
here's an Asian lady, and she had, you can see the lash tissue pushing on her lashes. And so our after picture, we took care of that. This gentleman here also had eyelashes, being pushed down by his skin. And he also had a little basal cell carcinoma in his lower lid there, which I fixed. And you can see how nice he looks there. This gentleman, again, has droopy eyelids, affecting his vision, but is also pushing on his lashes. You can see the nice after picture there.
It's amazing how much more awake they look after.
Yeah, and this lady, had a hard time opening her lids because of the muscle, so we tightened the muscle. And you can see no real scars because I use a laser for all my incisions. This gentleman here also, his eyebrows and his eyelids were droopy, and we fixed both his eyebrows and his eyelids through a laser incision and glue. This gentleman also had droopy eyebrows and eyelashes, and we fixed both of those as well. Took a few of those little lesions off and tightened them up. And this lady here, you can see, had quite a bit of drooping eyebrows and eyelids. We did an endoscopic brow, which is through the forehead incision, and this lady as well through the forehead incision. And both those ladies had significant improvement of her eyebrows and eyelids, and also no wrinkles in the forehead from the eyebrow incision. So
that's a great news right there, too.
Yeah.
It's amazing some of the results that happen here. You mentioned some of the ways that you do it. You actually do this very differently from other people. In fact, the only person in the entire country who does it the way you do it.
Correct. I do sutureless, bladeless eyelid lift. So I use a CO2 laser for all my dissection and cutting, and then I close with a tissue sealant. So I've reduced, any swelling and bruising significantly by using those two techniques.
I would imagine the recovery time on that is going to be much faster too, right?
Correct. The recovery time is much faster because you don't get as much bruising or swelling because we reduce the bleeding from the laser and from the tissue sealant.
We mentioned those pictures that we saw. Those were all covered by insurance, correct?
Correct.
If someone has a procedure that maybe isn't covered by insurance, this is still a great option. They can still see some great results, right?
Great. That's correct. We do a lot of what we consider cosmetic eyelid lifts, and we use the same technique, and they have great results.
Now, eyelids seem to be your specialty. That's pretty much all you do. That's like what you focus on, right?
Right. I focus kind of on the eyelids and eyebrow. I consider myself the eyelid expert, kind of my passion. So, there's a lot of people who do a lot of different things good, like breast augmentation. If you want to go get a good breast augmentation, you can go somewhere else. But if you want the best eyelid surgery or eyebrow surgery or face surgery, come to me.
You are the eyelid expert. In fact, that's the name of the website. If people want more information, want to see if they're a candidate for this or if their insurance will pay for it, can they just stop in? How do they do that?
Yeah, the best way is to give us a call. It's a pretty easy number to remember. It's 281-FACE. 281-3223 is the number. Or you can go to our website, which is eyelidexperts.com. And we do free consultations. Normally they're $100, but we're doing a free consultations currently. So come in and see us, and we can take a look, see if you qualify for insurance to cover your procedure.
Consultation is free, and the procedure might be covered by insurance, which seems like a great idea. We, of course, will have that link on our website as well, to the eyelidexpert.com. Thanks for stopping in.
Hey, appreciate it. Thanks.
Anytime.